The next presentation is Dr. Erik Jansen, and the title is Danish Experience in TBI Treatment.
Thank you for this opportunity to share some experience. After the previous lectures, I feel really humble, but I'm just a simple clinician and try to figure out what's going on with our patients. So I hope I can contribute to some other observations which might be useful, or anyway an interlude between the good lectures. One of our experience is that we had some Danish forces since 2006 in Afghanistan. And of course also occurred some losses of different kinds. And some 4 years ago, or 6 years ago, one of the soldiers was hit in the head by a sniper, and fortunately there was a doctor on the scene, so he was immediately intubated and ventilated and given the first aid. And everyone thought that this was really an impossible mission. But for some good reasons, everything worked out, and he was treated at the nearby field hospital. And this is the scans you have. This is a fragment. It's a bone fragment, and you see that he was hit through a helmet. And still, he was still alive, so we had to continue. We continued, sent him to a military hospital in Germany, and later on he came to our hospital, to the ICU, where he was extubated. And fortunately he survived, but some of the bullet and some of the bones in his brain could not be removed. Therefore, he had to be trained at a center which especially take care of traumatic brain injury, and was there for quite a long while. And later on, due to his epileptic seizures, he had to go to a specialized unit for that purpose. So almost 2 years later, he was back in his own home, severely debilitated. But soldiers fight for their life, so he got a lot of money from his comrades. He was then traveling to Thailand because stem cells was the offer of the day, and it is quite expensive. Where the cells came from, they were say, injected in Thailand. They were put somewhere into the spinal cord, or spinal area anyway. And of course it worked if you have so much support from your comrades, it is always working. It was not the improvement was not documented in any way. The soldier is still fighting for his life, and he heard that some few soldiers in the US Army had been treated in New Orleans by hyperbaric treatments, and an arrangement was made again. His comrade paid, and just before leaving, he came to us and said, couldn't he be treated in Copenhagen? I said, well, that's a new question coming up, because we have not treated any patients with a traumatic brain injury before. It's not just to say yes. And they said, well, all arrangements had been used concerning his stay in the United States, and he went there. He got 50 sessions with what we consider pretty low pressure, equivalent 1.25 to what was called the more dangerous thing, 1.5 ATA. We had an arrangement that I should have all the information during the stay, and at the end of the treatment series, he got 50 sessions. Then it was not possible, unfortunately, to have a very exact information about the outcome. But more hyperbaric treatments were recommended. He brought back some SPECT scans. It was a JPEG series, so we don't know really, cannot determine in full detail, give the full right of those who made it. But in our group, we are not able to find any difference. However, the patient here is still very handicapped. And we had to decide what to do, because of course we would like to support him. We went through all the literature, made a risk assessment. He was evaluated by a neurologist, PET CT scans, and then we should give him, we planned 30 sessions. And the day before we should start, he just said, by the way, do you know I have a baclofen pump? So we had to change the pressure. And then the intention was to make neurology afterwards and PT scan after. The risk assessment was that still we had this picture, what could happen if he got epileptic seizures. Could he have increased demand more than would be feasible for his tissue? Would he have a bleeding? Could he have a rupture of the vessels? Could his indwelling baclofen pump really be malfunctioning during pressure? But what's the benefit? Even he was severely hit. So even a small improvement would be a high value for this person. He's 30 years and has, by the handicaps he has, he would have the normal lifespan. And after the information that this baclofen pump only permitting 2.0 ATA, would that be effective? But fortunately we had the HORTIS 2 study showing that concerning the other patients, which be in the same chamber, it would be effective. The symptoms before was slow speech, or even some kind, no knowledge about the words. He was not very, had a reduced ability to concentrate. He couldn't lift his right shoulder. He was partly right-sided hemiplegic. He had increased tonus on both sides and hyperreflexia of the right arm and both legs. So after the first 30 sessions, we found that he had improved directional right foot and improved gait function. And at the cognitive tests, he had more rapid reactions, but also more mistakes. The in the gait training in such system, he had a therapist to direct his foot. And he was only able to walk for a few minutes in the beginning, but after the 30 sessions, it was 40 minutes. There was no improvement of the right arm. He was able to turn himself a little bit more in bed, which is very essential for a person, and there's leg clonus. And to look into the confusion, the other problems that might occur, better training. In this series, he got almost no physiotherapy of more conventional art kind. So he tells himself that he's more able to move in the bed. Otherwise, he had an assistant or his wife to turn him. And otherwise, he was quite happy about it. When we look into the PET scan, this is before. You can see this huge loss of cerebral tissue, and this is a function, this metabolic metabolism before the treatments, and here after 30 sessions. And those who are specialists within the field, they say it's a remarkable alteration. And this alteration goes quite well with the functional improvements. So the patient's opinion, the neurologist's findings, and the PET scans indicate an improved cerebral function. And you cannot do that in a small country with 5 million patients. 5 million persons without coming on the front page of the national media. And we got a lot of patients who want to be treated the same way, but protocols should be made. He thought it had some improvement, but he's a soldier, he's fighting for his life, so he went back and said that if it worked, he would have a new series. So he, at the beginning, before the second series, he was supported by a lift in the ceiling, as the picture you saw before, a walker and 2 persons. And after the next 30 sessions, he had training with support of 1 person and a walker. The spasticity was reduced, muscular endurance was increased, and he did not need the drop foot braces anymore. And he was now able, by his own force, to turn in bed. And as discussed before, what is the long-term effect? When I talked to the patient, I just did it on telephone last week, and he's able to speak telephone. That was not possible at our first talk. And he describes this at both sessions, both series, he felt that he got 3 steps forward and 1 step afterwards after some time, after a month or 2. So this may be one of the items which should be looked more into at a later stage. Of course, he has written a book about his experience. The next, after this successful thing, then we were referred a 60-year-old woman. She was fairly, half a year later, earlier, she had operation radiation for malignant cerebral tumor. She was considered without malignant tissue. She was referred due to rapid intellectual deterioration and had a single epileptic event after the operation, and she was just on a regular anti-epileptic medication, and we made the full investigation with extensive clinical and imaging status. However, she was received 18 minutes after HBO. She got focal seizures of the same kind she had after operation. We didn't stop that reason. 5 minutes air break. 17 minutes after, she gets seizures again. On day 2, exactly the same, and we considered that further treatment was impossible and maybe even dangerous for her.